Hi everyone, this is Dr. Mark LeMay. I'm a chiropractor and applied clinical nutritionist, and you're probably wondering, what have I got on here today? So with me is Shelise Irby. She is a registered dietitian, and she's going to be talking about the heart sound recorder. So tell us a little bit about that, Shelise.
So the heart sound recorder is a non-diagnostic tool that we use to measure stress on the heart. Pretty much what the heart sound recorder does is it measures the rate, rhythm, and tone of the heart. So the rate is just how fast the heart is beating, the rhythm is the pattern that the heart is beating in, and the tone is just how tonified is the muscle of the heart, so how strong is the heart muscle. And that can give us a really great indicator as to the overall health of the patient. And the heart sound recorder is really special in another way because the way that we measure those heart sounds is with this tool that I have strapped to Dr. Mark LeMay, and it is actually a very special microphone, and it's a microphone called an accelerometer, and that's what scientists use to measure earthquakes. And so it gives us a very good idea of how the heart is moving through space, how it's functionally, mechanically moving. And so that gives us a great idea of how the health of the heart is and if it's under stress.
So an EKG really checks the electrical system of the heart, correct?
Mm-hmm.
So think of it as like this, and this is the way I want you to tell the difference between an EKG and a heart sound recorder. The EKG, the analogy I would use is like a car engine. The electrical system that starts that car. You can start the car, vroom, like that. And you're like, yeah, okay, the car started, everything like that, but then what's it running like afterwards? Is it running really nice and smooth, or is it going chug, 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 like that? That's what we want to find out. That's what the heart sound recorder does.
Yes.
It looks at the movement and the function of the heart, not just its electrical system.
Correct. So we're going to test Dr. Mark LeMay here in the office so you guys can get an idea of what the test looks like. Are you ready?
I am ready.
All right, so we're ready to test Dr. Mark LeMay's mitral valve. So this is where I have the accelerometer microphone set up. This is not where his mitral valve is located, but it's the best place to get the sound recording from it. So what we're looking at is the 4 different valves of the heart. So we're going to measure each of those. I'm going to demonstrate for everyone how I measure one of those valves, and then we'll just skip forward to the results at the end of the video. So first thing I'm going to do is I measured Dr. Mark LeMay's blood pressure, and I measured his percent oxygenation, and I also took his heart rate. So we already did that. Now I'm going to ask Dr. LeMay what type of supplements he's taking for his heart, and if he's on any medications.
So no medications, and I am on a protocol because about 2 weeks ago we did this and found out that I needed a few things. So I'm on Cataplex G, Cataplex B, Cardiotropin PMG, and soybean lecithin.
Okay, so I have all those written into my notes, and now we're going to do the testing. So I want you to not talk while we're doing the testing because your vocal cords will be picked up by the microphone. I also want you to try to breathe as evenly as possible, not take deep in breaths or deep out breaths. All right?
Okay.
So here's the recording for Dr. Mark LeMay. I have a really great pattern. Here of his heart sounds, and I'm going to start the actual recording. I can still talk, but he can't. So we're going to wait while the recording is finishing, and I was really happy with the placing that we had. If I don't get the right sound, then I might move the microphone around a little bit to make sure that I'm getting it in the right spot. And it already finished. So we have the recording right here. We're going to finish the other 3, and then we'll have the results. Hi everyone, we're back with Dr. Mark LeMay's results. It was a really easy scan to do, and here we have the readout. So What we measured for Dr. LeMay was his mitral valve, tricuspid valve, aortic, and pulmonic valve. So these each have a different function in the body about where they pump blood. And I would say overall, they looked really great. I mean, he has a nice rhythm. So the beat of his heart, he's got the first sound here, the second sound here, the lub-dub that you hear when you listen to someone's heartbeat is very obvious in this pattern. The tricuspid valve, however, we do have a little bit of a pattern here, what we can call maybe a pattern interrupt. And so the first sound is a little too long. I'm sure you guys can see that's not what a heartbeat should look like. And so here we might need some nutritional support to help with the tricuspid valve specifically.
Question for you too, Shelise. If you see something like that, would the patient really pick up any kind of like symptom if they had that kind of pattern like I have? What would it manifest itself as? What would they see?
Yeah, that's a great question. So overall, since your heart patterns are really close to ideal, I would say that you probably wouldn't have any symptoms. Okay. I mean, most people nowadays, heart disease is the #1 killer in the United States, and almost most people who have heart issues don't have any symptoms at all. If you did have symptoms, it might look something like fatigue, or maybe after exercise, your heart feels like it's racing, or some people can describe it as it feels like it's beating out of their chest. Also, eating a large meal, sometimes after laying down to rest at night, if your heart feels like it is not at rest. Some people
had that feeling.
Some people describe it as like a flutter in a sense. So those are all symptoms, or even people have, complained of occasional chest pain. And, those are really serious symptoms that should be looked into, because the heart can function for so long. It's the only organ and muscle in the body that never rests. I mean, it's constantly functioning. We can't live without our heart beating. And so if the heart is under the most stress, like I said, it's a great representation of the whole body, because it's the organ that requires the most support. So if a patient were to come in and their scan was looking very irregular, then I would definitely say they would have fatigue, and it might not be related to, their stress levels. It might not be related to what they're doing physically. It would be more related to nutritional support needed for the heart, for circulation support.
So by giving them certain nutritional supplementation like that, they can actually start correcting some of those irregularities of their heart.
Yeah, it might be that the heart isn't getting the right nutrition. Like, that could be related to digestion. It could be the heart needs more, trace mineral support. It could be that the heart, in combination with an electrical issue with the heart, it's not able to contract correctly. So there's a lot of things that, B vitamins that the heart needs that are lacking in the average American diet.
You mean like Cataplex B and Cataplex G? Like I'm taking?
Yeah, so for you, I would say continue with the products that you're taking. This scan does look much better than the one that we did a couple of months ago. So there's definite improvement.
Yeah, so about 2 weeks ago we did that one.
Oh yeah, it was 2 weeks ago, So we do have great improvement. The pattern is much more regular. There's no leakage of the valve, and we know that because these lines in between the beats are very straight. So the only thing we need is maybe some more strength support for the tone of the heart. The first sound isn't as strong as you would like to see. And we do have some irregularities here with the first sound being too long. Other than that, it looks really, really close to ideal.
Shelise, I just want to say thank you so much for coming here and showing us the heart sound recorder. And for more information, call our office at 916-965-8171. I'm Dr. Mark LeMay, and thanks for watching.